Hi, my name is Chris Nutting. I often get asked by patients, which is the easiest treatment, chemotherapy or immunotherapy? Patients ask this because both of these treatments are commonly used in the treatment of head and neck cancer. There have been some trials performed in the last 5 years which compared chemotherapy and immunotherapy directly with one another. And the conclusion of those trials is that patient selection is important to understand which patients are most likely to benefit from immunotherapy and which ones would be better off treated with chemotherapy in the first instance. However, the trials provide really compelling evidence that the side effects of the two treatments are really quite different. Chemotherapy for head and neck cancer typically is given intravenously. We need to give anti-sickness medication alongside the treatment, and the common side effects include tiredness, loss of appetite, poor taste, sometimes soreness in the mouth, sometimes feeling a bit sick or even being sick in a small proportion of patients. Some patients get thinning of their hair, although hair loss is rare. And most patients have a risk of a small number of rarer side effects, such as effects on the sensory nerves, affecting feeling in the fingers and toes, or on their hearing, when sometimes they can get tinnitus. Immunotherapy, by comparison, is generally much easier tolerated by patients. The main side effect is lethargy or tiredness, which is reported in about 80% of patients. Most of the common side effects of chemotherapy, which are well known to most people, are not present with immunotherapy. However, immunotherapy does have its own rare and sometimes serious side effects. The way immunotherapy works is by turning up the body's immune system to try and make it fight the cancer. And just occasionally, in about 10% or less, that heightened immune response can lead to the drugs affecting your body's own organs. Sometimes it can cause inflammation of the lungs, leading to breathlessness or cough. Sometimes inflammation of the bowel leading to diarrhea, and there are a long list of other autoimmune side effects. But generally speaking, the trials are pretty conclusive that immunotherapy is easier for patients to receive than chemotherapy.